Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. In your role as a pharmacy informaticist, you want to maintain good communication and a good working relationship with your medication safety pharmacist. Together, you can work to ensure that your systems are set up for success for the clinicians in avoiding adverse drug events. In addressing these issues and setting up your databases properly and your screens in your EMR and other aspects that can really aid the clinicians, I want to talk a little bit about tools that you can use towards this goal. And specifically, I want to talk about the Institute of Safe Medication Practices. Jump to their website and really explore a little bit what's going on there. There's a lot of good resources there, and I want to just touch base and show you some of the things that are there and see how you can focus in as a pharmacy informaticist and as a medication safety pharmacist to really look at adverse drug events that have occurred in the past at other institutions and make sure that those do not occur at your institution. Let's go ahead and look at the website. So this is the ISMP, Institute of Safe Medication Practices website. If you're not familiar with it, I really encourage you to go and explore all of the different headings that are here with consulting and education, tools and resources, publications and alerts, error reporting, and you can actually become a member and have a login. Let me first go to tools and resources. In my next episode, I'm going to talk a little bit more about clinical decision support, specifically something I didn't cover in detail before, and that is passive clinical decision support. We talked a lot about active clinical decision support, where you have allergy checking, drug-drug interactions, pop-up warnings, expert rules. In the case of passive, one of the tools that we use is tall-man lettering. So you can see that there are some resources here on the ISMP website that relate to that, and I'll talk about that in my next episode. For now, I wanted to go to publications and alerts. And you see here that alerts that have occurred from the FDA and have been received by ISMP and other organizations are listed out here. If you jump to the alerts section and scroll up a little bit, you can see the definitions of their med safety alerts and the different sources that they come from. And here I went specifically to FDA alerts, and you can see these listed out here. Now, as a med safety pharmacist, you always want to be looking at adverse drug events that have occurred at your institution and others, and really do your due diligence with root cause analysis, finding out what went wrong, and putting safeguards into place so that those errors do not occur again. So by reviewing issues that have been reported by the FDA or ISMP or other organizations, you can really work towards making your system proactively a lot safer for your clinicians to use. So let's look at this one at the top of the list here. There's an adverse drug event that's been reported that has occurred apparently at multiple institutions across the country. And what's happening is there's a adhesive cover that comes with the clonidine patch. So the patch itself has the medication, and then the adhesive cover to cover the skin does not. And the error that's occurring is that the caregiver, the nurse, probably is not putting on the medication patch, but only putting on the adhesive cover. And obviously, this basically is a situation where the medication is not going to be effective because the patient is not receiving the medication. So as a pharmacy informaticist, I would look at this and say, okay, let me have a discussion with my med safety pharmacist, and let's talk about the best ways to ensure that this doesn't happen at our institution. I would look at how prescribing occurs on our EMR, and I would probably focus in on the medication administration record, where the nurse documents medications that have been administered to the patient. And the way that medications show up there is very critical. So in the case of the clonidine patch, we probably want to set it up, if it's not set up already, as a compound medication that has two components, kind of like an IV and an IV additive, but here we would have two components. The other thing that I would think about as a possibility is creating two different entries into our database, one for the adhesive patch and one for the medication patch. And in doing that, we could list both of those on the MAR. Now, personally, I would not take this path because it can lead to a med error, and I've seen this happen before with other medications where we basically have built into the MAR a warning system by putting an extra entry on something that the nurse is required to do in addition to giving the medication. And what's happened in the past in these situations is the nurse gets confused and gives the medication twice. So we want to avoid that. So I probably wouldn't use that route for addressing this issue. But this might be a really good situation where we would develop an expert rule. And every time clonidine is ordered and is going to be administered, the nurse goes to document on the MAR, then you would have a pop-up screen that shows a warning or a reminder, let's say, that both the adhesive cover and the medication patch need to be administered to the patient in order for this to be administered properly. So just one specific example. Now you see there's a lot of alerts that are coming out, and there are summaries that are available on the FDA website. So I would probably look at both websites to really get the full picture. But this was just one way of focusing in on specifically the ISMP website and giving you an idea of how you can work as a pharmacy informaticist with your med safety pharmacist to address adverse drug events that have occurred at your institution and other institutions, and then look at your systems and try to improve them, put safeguards in place so that these adverse drug events do not occur in the future at your institution. If you found this video helpful, please like it and subscribe to my channel. And in the meantime, I'll work on more episodes. And I just ask you to stay safe, stay healthy, and look after the health of others. And I hope to see you next time. Take care.